we have anemia. So, of course, when you look at this, you should be able to know it's a common thing. And even in the world, you'll find a lot of patients who are said to have anemia or low hemoglobin level. Yeah, and of course, from the full hemogram, you should be able to know, the normal levels of hemoglobin. And so when you talk of anemia, you're talking about low hemoglobin level. And most of the time, it could be because there is low number of red blood cells within the body. So it could be caused by many causes, including the inability of the blood. So when you talk of anemia, if you have less hemoglobin, there will be less ability of the blood to carry oxygen. So there will be inability of blood to carry enough oxygen to meet body needs. And so somebody will have problems because the body will not be able to get enough oxygen because there are not enough red blood cells to carry oxygen. So there could be production of insufficient or defective erythrocytes. So there's less production of red blood cells, or it could be the production of red blood cells, but they are defective. For example, there could be iron deficiency, because one of the things that is required for normal production of red blood cells will be iron. Yeah. So if you have iron deficiency, you are likely to have insufficient production of red blood cells. Also, if you have vitamin B12 or folic acid deficiency, you are likely to have anemia or because of poor production of insufficient or defective erythrocyte. That is why for pregnant mothers, for example, we supplement iron and even folic acid to help with the production of red blood cells. And also there may be bone marrow failure. So one of the causes of anemia could be bone marrow failure, so that the bone marrow is not producing enough red blood cells. So you end up with anemia. It could also be because of blood loss. For example, in hemorrhage, if somebody is injured and they bleed a lot, they lose a lot of blood, you end up with anemia because of blood loss. For example, even in ladies, sometimes some ladies have excessive menstrual period. So they have what we call menorrhagia. That is, they lose a lot of blood during their menses. And so they may end up with anemia. And then also you can have excessive erythrocyte breakdown. You can have hemolysis. Yeah, you can have hemolysis. For example, in severe malaria, for example, because one of the things that happen with malaria is these parasites, the plasmodium, tend to infect red blood cells, and then they may destroy them actually. So you have breakdown of red blood cells. We call hemolysis. So some of the things, of course, that can cause blood loss could be hemorrhage, that is basically bleeding, accelerated hemolysis, that is destruction of red blood cells, including, for example, in a patient who have sickle cell. One of the, which I think I'll mention as you go on, sickle cell anemia. You can have sickle cell anemia basically by productions of those sickled red blood cells that are easily destroyed in the body. So you have hemolysis. Sickle cell anemia. I've already mentioned that is in sickle cell anemia, sickle cell disease. So we have sickle cell disease. So when we talk about sickle cell anemia, we are talking about a low hemoglobin level that is caused by sickle cell disease. So sickle cell anemia is abnormal hemoglobin molecules become, so abnormal hemoglobin molecule become misshapen when deoxygenated, making erythrocytes sickle-shaped. So sickle, I know all of us have sickle, the one we use to cut grass. At least people rarely use it nowadays. Yeah, and I know in your mother tongue or in Kiswahili, you know the name. So they look like that. Yeah, that shape. So, and this one usually, because the hemoglobin is abnormal, when they are exposed to deoxygenated, that means maybe you are in a scenario where there is not enough oxygen, they become sickled. Yeah. In situation where there is dehydration, also in situation where there is dehydration, that is, you've lost a lot of water and you are dehydrated, that is also one thing that triggers them to become sickled. So if the cells contain a high proportion of abnormal hemoglobin, sickling is permanent. So in cases where the cells have a lot of abnormal hemoglobin, so these cells become sickled permanently. Sickle cells are rapidly removed and hemolyzed, leading to anemia. So these abnormal sickle appearing red blood cells are usually rapidly removed and hemolyzed or destroyed, leading to anemia. So that is what causes anemia, because of the destruction of those abnormal looking red blood cells, sickled cells. So sickle cells do not move smoothly through the circulation. So, and usually the red blood cells should be able to squeeze even the smallest capillaries. But now in this case, they become sickle, they're not malleable. They cannot be able to squeeze through those small, and so they tend to block. So one of the things, pathogenesis of sickle cell is that they block those small blood vessels, capillaries, and so on. And so somebody end up with ischemia in various tissues. So they end up with painful crisis, for example, because of ischemia in the areas that are supplied by those capillaries. Because once they become small, these sickle cells are not able to squeeze through very small blood vessels. So sickle cells tend to obstruct blood flow, leading to intravascular clotting, tissue ischemia, and even infarction. And those are one of the things that I think when you move to the clinical area, and this is very common. Sickle cell disease is quite common. If you go to the pediatric ward, you will always see sickle cell disease. There are very many children with this condition, and usually is a disease that is inherited. So in fact, we usually insist that if possible, all of us should be checked for our sickle cell trait, that you should be checked whether you have those sickle trait. Because if somebody who have a sickle cell trait get married to somebody who has a sickle cell trait, then they are likely to get a child who has sickle cell disease. And usually very challenging. These are children who are always in and out of hospital. They're always being admitted because of this crisis, painful crisis, loss of blood. So they come with very low blood levels. Somebody may come with a hemoglobin level of 2, which is very low. The normal will be from 10 and above. So that's why we encourage people, if possible, that we should all be checked. Those of us who are not yet married, you should be checked for sickle cell, just like the way we do for the people who do weddings. We do HIV test for them to make sure we don't marry people who are HIV positive. Yeah. So likewise with sickle cell disease, ideally all of us should be checked. We should know our status so that we can be able to prevent. So that ideally, if you are straight, you should ensure maybe the person you marry should be somebody with no trait, so that you don't end up with children with sickle cell disease, because it's a very difficult disease to treat. So sickle cells obstruct blood flow, leading to intravascular clotting, tissue ischemia, and infarction. So we have acute episodes like we call them sickle cell crisis. So they come with painful crisis. They may come even with problem with breathing. They may come with pain in the lower limbs, in the upper limbs, so that because of blockage of small blood vessels, and so blood is not reaching to those areas. Of course, it can even lead to kidney failure, kidney injury, any organ, because as long as blood vessels are there, they can be blocked. So they caused by blockage of small vessels, which cause acute pain in the affected area, often the hands and the feet. So mostly it tends to affect the hands and the feet, but of course it can affect any organ. So it tends to affect the black mostly, more affected if you compare with the white people. So some individuals with sickle cell anemia have a degree of immunity to malaria because the lifespan of sickle cells is shorter than the time needed for malaria parasite to mature inside the erythrocytes. So remember the lifespan of red blood cells, I think we talked about around 120 days. That is the lifespan. And mostly malaria parasites, as I've already said, tend to infect or enter the red blood cells. So if the red blood cells are destroyed, because sickled red blood cells have a very low, shorter lifespan, so they tend to be destroyed early, and of course with the virus, with the parasite that is causing malaria. So people tend to be a bit more immune to being infected by malaria. And maybe that is what is thought, because when you look at malaria endemic regions like Western, maybe Nyanza, and of course, the sickle cell disease seems to be common around those areas. So people think maybe it was a kind of adaptation to be able to, because malaria is very common, to try and create immunity, but nobody yet is sure really the cause. Of course, currently, sickle cell is everywhere because people intermarry and people are everywhere in this country. So there cannot be a place where you can talk of having no sickle cell. So I think the only way is probably to have ourselves checked so that we know our sickle cell trait, whether we have sickle cell, we have the trait or not, and then be able to try and prevent as much as possible. So these people, that is what is thought, that some individuals, because of when they have a sickle cell, they tend to have immunity against malaria because that lifespan of sickle cells are shorter. Yeah, and so the malaria parasite doesn't have time to mature. They are destroyed before because these sickle cells are destroyed. And then, of course, that is just a picture showing the way the normal red blood cells, you can see the normal erythrocytes, and then you can see the sickled erythrocytes. Usually they tend to be brittle, they tend to be very hard, so they cannot squeeze through very small blood vessels, and that is how they end up having hemolysis. Yeah, and they end up being destroyed early.